be doing bed bath and pericare. For the sake of the skill, we've already gone in, identified the patient using 2 identifiers, assessed range of motion, and we identified that they wanted bed bath as compared to shower or normal bath. So I've already gathered the supplies, which due to not enough supplies, I will verbalize when I would discard a supply and then reuse it. I've already raised the bed to hip level with side rails up. Then lower this side of the rail. Before I begin the bath, I'm going to need to get water over there. I would make sure that it's lukewarm. I would then have patient or resident test the water to make sure that it's as warm as they want it. I would then bring the bedside table over here. And before I begin, I'm going to provide privacy by drawing curtains, closing blinds, closing doors. I'm going to wash my hands and grab gloves. If at any time gloves become too soiled during this, I will discard them and grab a new pair of gloves. I'm going to make sure that they're tight so that there aren't any rips or tears in the gloves. Now, normally I would use new bath towel or new washcloths, but we're short on supplies. I'm just going to assume that I would have thrown those in soiled linens and then had new ones. I'm going to put bath blanket over them while lowering the blanket. Provide privacy in case there's anyone in the room here with them, such as friends, relatives. Making sure to do this on the side with the lowered rail so that I'm not reaching over the rail. Now that they're covered, I'm going to remove any clothing, or in this case, the gown, while making sure to keep them covered as much as possible. Do not expose them to anyone that may be in the room. Fold this up. I will put this in soiled linens. Making sure that the other, there we go. Trying to make sure that I have this fully folded out for them. Depending on patient or resident's wants, I would add soap to the water before washing face if they wanted that. In this case, I'm just going to be washing and drying. I would remove the pillow from under their head and place a towel under their head. I'll put the pillow over here for now. I would then soak the washcloth. And I would do downward motion like that. Fold it back under the eyelid, and I would repeat for the other side, but I'll only be doing half the face for the sake of the skill. And if they wanted ears or neck, I would also do that. I would then discard the cloth. I'd grab a towel and pat dry softly to not irritate the skin, observing for any bruises or breaks in the skin. Fold this up to a clean side so that we can use later, making sure that the use side is not on the outside of anything that I will be placing it on. And then I can move down to the arm. Place fresh towel under their arm. Making sure not to put it at an awkward angle or anything, supporting it as much as possible. Making sure that it's about centered so that we can dry it later. With soap added now into the water, I would rinse a new cloth. And from the shoulder down, I'm going to wipe to the hand while supporting at the elbow. I'm going to, in one motion, go over and towards the armpit. Set that down. I would put that in soiled linens. For the sake of skill, I'll reuse it later. And then pat dry. And for the sake of the skill, again, I would discard that, but I will reuse this later for pericare. And assume that it was a fresh towel. Now, exposing as little as possible while doing this. I'm going to use a fresh cloth. Wipe chest area. Fold it down. Fold, wiping under any folds in the skin. Washing the abdomen area, wiping the side. I'll then discard that, but I will use it later for the sake of the skill. I'll then grab a fresh towel and pat dry, making sure to dry under any folds in the skin. And I would do that for the other side as well, but during the skill I will only be washing one side. I would discard that, but I'm going to reuse this towel since we don't have enough here. Now, trying to expose as little as possible, I'm going to move towards pericare. So I'm going to grab some water. I'm going to wipe once down the middle. Once kind of just over the center, and then once on each side, flipping to a new side of the washcloth each time. And I would discard that, but I will reuse this washcloth later. Grab an unused towel and pat it dry. I would discard that. I will reuse it for the sake of skill. And then cover them as much as possible. And I will move down towards the leg. Grab an unused towel and put it under the leg like I did the arm, supporting it in case they don't have range of motion. And then wash. Start with the inside towards the feet. Use a new side. Start on the outside. Just making sure that the leg is fully washed. Wash the back as well. Then I would discard washcloth would then pat dry. Fold that up, and I would put that in soiled linens. I actually think I have enough now to where I can. Providing any hand and foot care as needed. Then I would try to have them hold onto the side rail. If they weren't able to hold themselves up, I would have a partner in here with me who could hold them while I'm washing their back. I will put them on their side, exposing them as little as possible. Using a new cloth, I'd wash down their back, using a new side with each swipe. And then put this in soiled linens. Now I'll do gluteal pericare, wiping away from the genital area. I'm going to wipe up, and then once on each side. I would then discard that, making sure to pat dry the back, and then using a new towel, I'll also pat dry the gluteal area. I will discard that. Now I will roll them back onto their back. I will give them a new gown. Trying to expose as little as possible. I'll then raise this side up as I'm going to put on the other side. Now, pull their blankets back up and remove the bath towel. And put that in soiled linens. And I will properly dispose of the water in the designated area. I'd put this back in its designated area as well. I would remove gloves and perform hand hygiene. And then make sure the patient is comfortable. I'm going to perform this on the other side. Raise the bed rail up. I'm going going to remove the towel that we put under their head earlier. Put the pillow back under. Dispose of this in case it got any water when we were performing head hygiene. Make sure that they're comfortable. If they need anything else, I will give them their call light. I'll remove privacy, and I will leave the seal.